Overall, the risk to the general public from these cases is low because most Minnesotans are vaccinated for measles through routine immunizations that have been required for school attendance. Most of the children involved were already isolated when their symptoms started. So exposures were limited to healthcare and family settings. However, it just takes one case of travel-associated measles passing it on to somebody else in the community who is not yet vaccinated to start an outbreak in a community with lower vaccination rates. Any case of measles causes concern for health officials. Measles spreads easily by coughing, talking, or being in the same room with someone who has measles. Initial symptoms of measles includes a high fever, a cough, runny nose, watery eyes, followed by a rash that typically spreads from the head to the rest of the body. It generally takes 8 to 12 days from exposure to somebody with measles to the first symptom, which is usually fever. The measles rash usually appears 2 to 3 days after the fever begins. If you have symptoms of measles, call your doctor or clinic, and they will let you know if you need to come in for a visit. Measles was declared eliminated in the U.S. in 2000, but it is still common in other parts of the world. In a typical year, Minnesota sees 1 to 4 cases of measles, generally in people who traveled to countries where measles is more common. There are measles outbreaks occurring in many countries around the world, and measles is common in other countries. So it is important for anyone from the U.S. who is traveling overseas to be vaccinated or have immunity against measles. In 2018, there were more than 140,000 measles deaths globally, mostly among children less than the age of 5. We need to maintain our high vaccination rates to make sure measles does not have a comeback in Minnesota. This comment was made by Margaret Roddy, who is a section manager for vaccine preventable diseases working at MDH. Margaret continues to say, as long as there is measles somewhere in the world and people travel, the risk to Minnesota remains. The measles vaccine is safe and effective. Without it, the risk of disease is real. The best way to prevent measles is through vaccination. Children should receive 2 doses of the MMR vaccine. The first dose should be at 12 to 15 months of age, and the second dose is at 4 to 6 years of age. Children 6 to 12 months should get an early dose of the MMR vaccine if they are traveling to a country where measles is common. For all ages, it is important to talk to your doctor if you are going to be traveling to another country. Your doctor can check to make sure that you and your family are up to date on your immunizations and make sure that you do not need any other immunizations. MDH encourages people to check their records to confirm that themselves and their children have received the MMR vaccine. Minnesotans can request their vaccination records by visiting the Find My Immunization Record website. Or for more information, they can visit the MDH Measles Specific website.